RNAO, the Registered Nurses Association of Ontario, is here for patients, is here for our community, is here for nurses. We are the strong, professional voice representing registered nurses within Ontario, nurses from every sector and in every role. Our mission is to pursue healthy public policy and promote the full participation of registered nurses in shaping and delivering health services now and in the future. As nurses, we are knowledge professionals who apply advanced knowledge and expertise when caring for our patients.
What RNAO offers to nurses really is a voice out there that speaks for nursing and for quality health care.
Because RNAO is able to shape the way the healthcare system as a system is looking. And nurses also, in their workplace, have the tools and have the evidence to be able to care for people in a way that is optimal for them, so that they experience, as a result of nurses, better and better outcomes on their health.
The simple truth is, nurses occupy a pivotal place in the healthcare system. Because of this, RNAO supports nurses to realize the power they have to help shape health policies that will benefit their patients and make the system more effective today and into the future. For well over a decade, RNAO's International Affairs and Best Practice Guidelines program has effectively researched, developed, and disseminated evidence-based best practice guidelines to nurses and other healthcare professionals. Best practice guidelines are knowledge-rich, evidence-based resources that have been developed by nurses for nurses.
So with a best practice guideline, you can be assured that the best research that is being carried out related to nursing care for patients is being introduced by nurses into their day-to-day clinical work with patients.
The RNAO has really taken all of the information and all of the best practice evidence and put it into one resource that can help us.
It standardizes how we approach things when it comes to patient care and how we improve.
It gives you really the most up-to-date evidence on a clinical situation and empowers you to want to use that evidence for patients.
Influencing the improvement of healthcare around the world, RNAO's best practice guidelines have been translated into multiple languages, and the organizations that implement them are seeing concrete results.
Best practice guidelines from the RNAO are essential to my work as a clinical nurse manager. It gives us more knowledge and empowers us. With that knowledge, we can then take it to the bedside.
I want to be doing the best job that I can for my patients. So using best practice guidelines, it would seem, is the logical way to reach that goal.
Whether it's helping patients quit smoking, providing nurses a full understanding of methadone treatments, pain management, falls prevention, wound care, or any number of other best practice guidelines, they lead to better health outcomes for patients, better working environments, and stronger organizations.
Champion Network consists of everybody who has been trained at the RNAO Best Practice Guideline workshops.
It's an opportunity to start dialogue around the best practice guidelines and what you've done and what they've done, and it's a way to really start working relationships with people and partnering.
The network really is about reaching out, connecting, giving legs to the evidence.
Thousands of nurses and other healthcare professionals from every role and region have benefited by participating in the Nursing Best Practice Champions Network. Being a part of this Champions Network means being part of a thriving community of individuals who are dedicated and passionate about providing the best care to patients, families, and communities. Our champions are change agents, influencers who work to improve their own workplaces and patient care through RNAO's best practice guidelines. We believe knowledge is power, and our champions have the power to make a difference for health and for healthcare.
It changes their lives, it empowers those nurses that become champions to be game changers.
It's nice to be able to call somebody, to have somebody come in, to have a workshop set up. That kind of support is invaluable.
Far more powerful than trying to do everything yourself.
For me, the network works because the RNAO helps facilitate that it works.
It's everyone working together to make it happen.
Being a champion makes me feel empowered, I really do. I feel like I can reach out to other nurses and really, really make a difference.